Jose. So today I'm bringing you the second lecture or second tutorial of the anatomy series that I'm doing on this channel. So the previous one was the anatomy of the skull and all the bones of the cranial bones and all the bones of the skull and everything. So today I've decided to do the anatomy of the vertebral column. And so on the left here we have the 3D structure, which is an app that's used, which I've downloaded onto my MacBook Pro. And on the right here, just to make things more clearer, is images that I found on Google, which I downloaded down. Just it's labeled images of the different parts of the vertebral column. So when I do refer to certain numbers or certain codes, which is denoted in the Greek term for anatomy of certain parts of the body, you might just want to move your eye across the right hand side of the screen, so which is this part here, so you get an idea of what I'm referring to. So in most of my anatomy videos I'll have a 3D structure on the left and then a label diagram towards the right, which I will be referring to, and the main purpose of it is because some people might not understand my accent of the way I talk, or so it might be much more clearer if you could look at the image. So on the left here we have our vertebral column, which some people refer to as a spinal column, or some people say that they broke their spine. Well, yeah, you can say that, but this is the part of the skeletal system, and it's referred to as the vertebral column. It's the bones that keep us up straight, help us to stand, and really supports the weight of most of our bodies. And the rib cage that protects your lungs and your heart, so the mediastinum, comes off the thoracic region, which I'll go into a bit more detail. So on the right here you can see that the vertebral column is split into 1, 2, 3, 4 sections. So first section goes from C1 to C7, which can be somewhere up to here. So on this diagram here on the right you can see C1 to C7, and that's known as the cervical vertebrae. The next section is the middle part, and this is known as the thoracic vertebrae, or the thoracic section, and there's 12 vertebral discs involved in this, and it's labeled T1 all the way down to T12. So the T stands for thoracic, and the numbers basically stand for the first thoracic vertebrae, the second, third, and so on all the way down onto 12. Then you have what is known as the lumbar region. Most patients who suffer from sciatica, which is back pain or something usually, most of these pains and everything originate from the lumbar region. Your nerves that innervate your urinary system, your bladder and everything origins or starts from here as well. So people who suffer from back pain and stuff usually end up affecting being affected in the bladder region, which means it can be quite fatal. In the lumbar region, it's the most prone area to back pain because of you have this jelly-like substance within the fibrocartilage. So fibrocartilage are things that go between these discs, so where the mouse is pointing to now. It's not shown in this diagram here, but if you look here on the right, it's these blue things here. These fibrocartilage are like shock absorbers. They're made from type 1 collagen and type 2. The purpose of them is basically they're cartilage, they're shock absorbers, and they resist tension and stress within your vertebral column, and they prevent two vertebrae touching from each other, which means it prevents innervation of nerve, which leads to pain and stuff. What happens is within the fibrocartilage you have this liquid, the synovial fluid. This fluid then protrudes outwards, which then presses down onto the nerve. Usually when it's in the lumbar region, the main nerve that comes off here is a sciatic nerve which goes down your leg or the femur, and this then when this protrusion, usually herniated disc, that's what they call it, usually compresses the sciatic nerve. It sends out pain signals, which causes excess and very severe pain, which travels down the back of your feet and around your back, and people really suffer. And the main treatments for that is codeine and normal regular painkillers and stuff like cocodamol, which is a mix of paracetamol and codeine. The irons are analgesics, so like morphine and things like that, and usually some muscles around this region contract as well. But the video here is not about pathology. Well, there is going to be a section of pathology of all the different pathology, essential pathology that I know of. But here we have the thoracic, the lumbar, and the final part, which is the back part, which is shown here, is known as sacral, and there's 5 regions here. Right, so if I was to go in detail with each of them, so C1, so if we zoom in, before we zoom in, we want to know the different areas. So if you look on this image here, we have, so you can see this 3D anatomy here is laid out exactly the same bit. So you've got this pointy spiny bit coming off the back. Now here you can see it's known as the cervical curvature. So this is your first curve, or the primary. It also refers to as secondary curve, and you can see this is like a concave shape. Here there's another curve which is known as the thoracic curvature, which is the primary curvature, and this is a convex shape. So if you remember your physics, your lens and stuff, you know what concave and convex are. Here again you have the secondary curvature, so this is your lumbar region, and then here you have your second primary curvature, your sacral region. So in all together you have 2 primary curvatures and 2 secondary curvatures that you want to be aware of. The primary, how you can remember it is the primary thoracic is really important, so you can remember that as being a primary. So if that's a primary, then the next bump or the concave shape is down in the sacral. So thoracic and sacral are primary, cervical and lumbar are both secondary curvatures, which is also indicated on the right here. Now if I was to go in detail with each of the cervical vertebrae, so if you zoom in right across there, you go around. So the first one, so you can see this is how the vertebrae look around. So we can see that the first one's known as atlas or C1. The second one is known as C2 axis. And then if we go down, we've got C3, C4, C5, and then so on all the way down onto C6 and then C7. So from C1, 1, 2, 3, 4, 5, 6, 7, this is known as the cervical region, and this is why they say it's very important that you don't tilt your neck or anything. And sometimes in anatomy, what you have is you have this spinal fibrous ligament here which goes around the back, which holds together all of these spines, which is not shown here, and that also restricts rotation of your neck. So hence the reason why you can't rotate your neck fully around it. You can only rotate it to a certain degree. So if you were to start in the middle, you would only be able to rotate it 90 degrees to your right or to your east, and then you'll struggle. You probably can just about get to about 110 degrees, and then you won't be able to go back, and that's because due to the fibrous ligament that goes around the back here, which is not shown in this 3D diagram nor in these pictures, but you will learn that when you learn your anatomy in school. So that's the cervical region. Now if I was to take one part of the vertebrae out, so this is what it looks like in terms of the different areas. If I move this down, so you got your anterior view, which is shown here, you got your lateral view, you got your posterior, and you got your lateral again. So if I was to show you from the top, so this is what it looks like. And to go in a bit more detail, what you want to look at is that image on the right hand side, on the top right. So here we have the basic anatomy of a vertebrate. We have the main body, which is here, and just above this bit is where the fibrocartilage sits. We have the spinous process, which comes off here where my mouse is pointing to now. We have the transverse process here. Then we have the intervertebral foramen, or the hole, which is here, through which the spinal cord passes through, and through here is other nerves that pass through these holes here. And we have something known as facets, which is shown here. This is known as the superior articular phases. There's articular phases as well as different types of phases, which I'll go through in a bit more detail in the other videos. So you know that the main thing that you want to know is the cervical part is here, and it consists from C1 all the way down to C7. Now, if we were to go back down, you start off with thoracic here, and this is just above your, right about your, just below your neck, and starting at your collarbone. So this is where your T1 starts, and then you got your T2, T3, T4, T5, all the way down, just like this, until T12, up to here where the green part is showing now. So that's your thoracic region. Now, there's two main things that you want to be aware of when looking at the thoracic region. What you want to be aware of is this bit. So if I was to isolate this by itself, you can see that with the thoracic region you have, it's the same, it looks the same. You have your intervertebral foramen here, you have your cell body, you have your spinous process, you have your transverse process here. Now the main difference that you want to know is you've got these little white blobby dots around here, and these are known as facets, right? So you've got your superior costal facets and your transverse costal facets. Now, from the name itself, what you can gather from here is that because this is known as a costal facet, so this is a T7 bone, which is shown here, and this is also known as the transverse costal facet. Again, see the name costal. It basically means this is where your ribs connect onto, your costal ribs. So ribs, another name for the ribs is costal, so this is where it connects onto. Now, if I was to move this across here to make your view clearer, now around the top we have what's known as articular phases, and we have superior articular phases, and on the bottom we have inferior articular phases. Now these phases, articular ones, the name what you want to be looking for is articular, and is the fact that these phases help T7 vertebrae or thoracic vertebrae attach with a vertebrae above. So the superior one will allow it to attach to a vertebrae above, and the inferior one, which is shown in the bottom, highlighted in the green, will allow it to attach to a vertebrae on the bottom. Now this one here is the inferior costal facet, so that's also attaches to ribs. Now if I was to remove this isolation, and for example if we were to get rid of this one, and zoom in on just this one, so you get a better idea of what I'm talking about. So you can see from here that if I was to fade this one, fade that one and keep that one, you can see that the facet, the inferior facet there, which is there, connects to the superior facet of this this bone here. So that's what I mean by the inferior articular facet of T5. T6 connects to the superior articular facet found here of the T7, and then that's how it goes downwards. So you have an articular one which connects a superior articular and an inferior. The inferior one connects to inferior connects to superior, and that's all you need to do. Superior and inferior connect to each other, and that's the key thing that you want to know. So the inferior articular facet of T6 connects with the superior articular facet of T7. And, you know, it might be a bit tricky now, but it's very simple. I guarantee you you'll be an expert in no time. Now, if we were to bring in the rib cages as well, so if I was to go down to control menu and bring in the rib cage, right, and get rid of this one, get rid of this one, just to make your view clearer, and get rid of that one. You can now see, if you zoom in, that this part here of the rib, so this is the 6th rib, and it connects onto the T6. So therefore, you can see that the little green bit that I'm pointing to now is known as the costal facet. So there's the superior, so that part attaches there, and then you have another part which was meant to be here, so the inferior, or the transverse costal, attaches here. Then you know that there's an inferior part on the bottom as well which doesn't attach. So the transverse and the superior costal faces are where the ribs attach. Hopefully that makes a bit more sense to you guys now. So I'll zoom that out. Now, the key part, what most students get wrong, it's the idea of when you get to the 12th rib, when you get to about the 11th rib, you have ribs which is known as floating ribs, and we'll come on to that a bit more when we look at the rib cage and the sternum and all of that. But if I was to hide this one and zoom in on this one, you notice that okay, before I go in, and you notice that on up to T10 you have an superior costal facet, as well as you have a transverse costal facet, and then you have your superior, and then you have your inferior. But one thing you want to notice is when you come down to thoracic vertebrae T11, you just have a superior facet, costal facet. You don't call it superior, nor do you call it inferior. You just have one on either side. So therefore, you just call it costal facet, but you have your superior articular facet as well as your inferior. So what that means is, now if I was to reverse, what that means is, so you can see here on the 12th rib, the rib only attaches to one place, which is the costal facet, whereas in the previous above ones, you can see that the rib attaches at two parts. You've got the superior and you've got the transverse costal part. So it's when it gets to T11 that you need to be aware. So up to T10, there's two facets to which the rib cage attaches onto, but when you reach T11 and T12, there's only one place which it can attach to. Now if I was to go back and hide the rib cage, a bit complicated how to use these machines, you know. Find it really a bit difficult. Now if I turn off the rib cage and go back, so we stopped at T9, T10, T11, T12. Now what we have below that is known as the lumbar region, and this is part of the secondary curvature. So this is the secondary curvature, as you can see on the right. And lumbar region has L1, so it starts here, which is just above your hip. L2, L3, and L4 is a region where most anesthetics usually give their lumbar puncture, which is puncturing the CSF fluid of the spinal nerve in the spinal column for things like meningitis and streptococcal meningitis and so on, and various different types of infections and stuff, as well as if you're undergoing a surgery or something, they want to numb that whole region. So you have L1, L2, L3, L4, you have L5, and then so there's 5 lumbar regions, and most people have back pain around L3 and L4. And then finally what you have is your sacrum. Sacrum is split into and this white bit here is known as the articular surface of sacrum, and that attaches to the hip. These holes are through which your nerves innervate, and then the bottom part, which is referred to as coccyx, coccyx, or you can refer to as CX1, and that's part of the primary curvature as well as the second primary curvature that you have in your body. So I hope, if I was to, before I end this video, if I just have a quick recap of all the different regions. So you have your cervical region, C1 down all the way down to C7. The first one's known as atlas, second one's known as axis. So the atlas is the one that goes through the foramen magnum. So if you don't know what the foramen magnum is, you need to go back and watch my anatomy tutorial on the skull. The foramen magnum is through which the atlas connects to the back of the bottom part of the head. And then from there, C1 all the way down to C7, and then the thoracic region, which is the primary curvature, or the concave curvature, you can call it. It's 12 sections, and it goes down all the way to T12, and then you have your lumbar curvature, L1 all the way down to L5, and then your sacral, and finally, not least, the thing that curves in is the coccyx. I hope that makes a bit more sense on your understanding of the vertebral column. If you have any doubts or any problems. Okay, before I go on, I want to touch upon one little pathology aspect of the spine. So scoliosis is an abnormal lateral rotational curvature of the spine. So in some patients, when you do an external examination, you can see that they have this curved spine bit, which is shown here in blue. And 10 to 20 degree is usually mild, and it's not very, it's not considered. It's still a problem for the patient, but it's not very emergent or very emerging sort of condition or an emergency. But it is still a cause of concern in which doctors might need to intervene. But when it's 20 to 40 degrees is when they carry out surgery or something to straighten it out, and it's moderate, and greater than 40 can be severe, which means the patient might not be able to walk or not even stand up straight. So bearing all that in mind, I'd just like to say, if you've enjoyed the video, please hit the like button. Make sure to share the video, show your friends who might be struggling with, learning anatomy. If you didn't, please, like the video, press the dislike button, and also write down what I could improve on making more videos, maybe to, give back a better learning experience to all of you. And hope to see you in your next video, and thank you once again.